All right, everyone, welcome back to another episode of Innovators of Health. Today we have with us Dr. Luke Bauserman and my co-host, Dr. Rahul Desai. Welcome, Luke. Thank you for joining.
Thanks for having me.
Yeah, so you're Family Tree Dental in Parkersburg, West Virginia. What do you say? Parkersburg? Is it Belpre, Ohio? Which location are you known for, or all of them?
Yeah, I work mainly out of Parkersburg, West Virginia. Family Tree Dental is the name of our general dentistry group. We have 4 general dentistry locations, and then we have one location there in Parkersburg as well that's called Better Sleep Mid-Ohio Valley, and that practice is limited to dental sleep medicine and TMD treatments, and that's mainly where I am.
Awesome. So do you actually live in Ohio or West Virginia?
I live in Ohio, so it's kind of like a border town. I'm on one side of the Ohio River, and my practice is on the other.
Oh, awesome. I know that area.
Went to Ohio University, is that correct? You're a Bobcat? Is that the?
Yeah, that's where I went for my undergrad.
Okay, excellent. Yeah, we're Jacob and I are both we grew up in Cincinnati.
Oh, okay, yeah.
So I'm a Buckeye.
Yep. I went to Ohio State for dental school, so
okay, nice.
Bobcat and a Buckeye, yeah.
Right.
Oh, how cool.
IO, right?
Let's go.
Well, I mean, so Luke, you have a unique path, from studying history to becoming a leading voice in dentistry and sleep medicine. So can you share your journey that led you to here?
Sure. Yeah, I guess in short, when I was going through my undergrad, I got some advice. They said that from a person that I look up to that said, for your undergrad, if you're planning on going on beyond a bachelor's degree, get the prerequisites for whatever it is that you need, but take courses from the people you enjoy taking courses from the most. And so that's what led to me getting a history degree. There was some fantastic professors in the history department at the community college where I was. But I always knew that I wanted to do something medical, and through the process of shadowing in some different offices and specialties, settled on dentistry. And so I went to dental school at Ohio State University, graduated in 2018, went straight into private practice. Pretty soon in my career, COVID and all of that happened. And that's what kind of sent me down the rabbit hole that I'm currently still going down. So COVID happened. We are a VA care in the community clinic, so we see a lot of VA patients. And during COVID, I got a message from one of the referring providers at the VA saying that they were having trouble getting CPAP machines for patients that were being diagnosed with obstructive sleep apnea. And that was also due to the Philips Respironics recall that was happening during that same period of time. And they wanted to know if I could do oral appliance therapy for sleep apnea for some of these patients. And I'd had very minimal exposure to oral appliance therapy in dental school. I actually had some more exposure from my days as a dental assistant before going to dental school. One of the dentists that I worked for had done a little bit of that. So I said yes, and I started doing oral appliance therapy for those patients, had good results, and I then wondered, well, how do I do this for people outside of the VA? Because I see a lot of people with other insurances in that too. And that just led to a several-year journey of learning more about medical billing as a dentist so that I could do that. And when you start doing oral appliance therapy, another name for it is a mandibular advancement appliance. And so you're bringing the mandible forward. And also, when you see a lot of sleep apnea patients, a common symptom of sleep apnea is nighttime bruxism, clenching and grinding your teeth. And a lot of that clenching and grinding can contribute to TMJ problems, temporomandibular joint disorders. So you can't really pick up one side of the, at least in my opinion, you can't really pick up just one side of the stick. You get both. If you're doing dental sleep medicine, you start to see more TMJ problems. And that is another area of dentistry and medicine where it doesn't seem like anybody gets a lot of great training in school, at least not at the program that I went to, just very, very, surface level stuff. So that sent me down the rabbit hole of trying to learn how to treat these problems. And that led me to the Spencer Study Club, Jameson Spencer's group. Jameson is like the guy when you're looking to learn how to do both dental sleep medicine and also TMJ treatments. And so I've quickly adopted him as my mentor in that field, and here I am.
Excellent. Is that how you got exposed to red vibe and red light therapy, or had you integrated that into your arsenal before, or what was the
No,
pathway?
so that was really how I got exposed to it, was through the webinars that you guys did with Jameson Spencer's group. I had a little bit of knowledge of it beforehand. We had actually looked into it about a year before those webinars. My youngest child was born she's about a year and a half old, but right after she was born, we looked at some red light therapy at home for my wife during her postpartum recovery. And we had it looks like a sleeping bag that has red light LEDs in it that she used, and noticed some benefit. I think the big difference with what we have and the Red Vive products is Red Vive incorporates the near infrared, which definitely seems to help with how deep into the tissue the light is penetrating. And so with the Red Vive products, we've noticed a definite edge over what we'd been exposed to before.
And how have you integrated it into the practice? And then I know, I definitely want to talk about some of the personal stories that you have too. But when you heard about it through the webinar, and then how did you start to implement it into the practice, and how have you seen it be successful?
Yeah, so I definitely have seen it be successful. So it just so happens that the webinars happened right around the same time that I was gearing up to implement TMJ treatments in my practice. I'd done a lot of dental sleep medicine, and I was like, it's time to start addressing some of these TMD problems that exist. And I had taken training from Jameson on doing PRF injections to treat temporomandibular joint disorders. And when I saw the webinar on red light and how those two things go together, both the orthobiologics and the photobiomodulation, it just really made sense to me. And so I thought, you know what, we're going to try to launch this like just together from the get-go. So from day one, as we started doing temporomandibular joint treatments, we bundled it in with our treatment package for patients. So they get PRF. If they're getting PRF, they get a red light panel. Now, what's been interesting is a lot of some of the things that we do in our exams for TMJ disorders involve measuring the range of motion of the patient's jaw, how far they can open. A lot of times people will get to where their jaw is locked and they can't open very far. And as I was going along, treating the first couple of cases, there were some patients that got a red light panel after they had started PRF, and there were some patients that got a red light panel about 2 weeks before they were scheduled for their first PRF injections. And so I was really paying attention to those patients and measuring their range of motion, after 2 weeks of photobiomodulation, but before PRF. And that was where I really started to see for myself how well it was working, because patients would come back in and the range of motion had increased, by 6 millimeters, which is a big deal when you're talking about somebody's jaw who's locked, and they hadn't had any other treatment. At that point, it was just the photobiomodulation, and also their pain level had been reduced significantly. So that was where I really saw the power of it, and was like, this is full steam ahead. These two things go together in our practice. We're bundling them.
Oh, that's so cool
That's
to
huge.
see that. We talk about preconditioning the
Yeah.
patients, but you're seeing, and that's what we were, uh, when we're doing regenerative medicine, it's that same application. It's like you get the tissue ready for it, but it's great that you had an objective outcome measure
Yeah.
that was demonstrating improvement even without the orthobiologic therapy.
We
Um,
also started doing, we have a Red Vive 300 on the stand in our office. And before we do a blood draw, we'll do 10 minutes under that for the patient. And my phlebotomist absolutely loves it. She's like, this is better than them holding like a warm compress over where I need to do the blood draw. And a lot of times, people come in, they're a little anxious, about having their blood drawn. Some people really don't like needles. And it just seems like not only from the medical benefit, but just also the kind of setting the tone for the appointment. It's nice to have 10 minutes of like, we're going to relax, and it's just under a nice warm light here.
yeah.
That's
Have
interesting.
you, has that become your standard of care now? Like to send if the opportunity exists to go home with the panel before, so they get that
Yeah,
reconditioning effect?
that has become our standard. So our typical workflow is we'll have a patient in for their initial consultation where we're kind of looking, trying to figure out the nature of their TMJ disorder and to get a diagnosis or to determine what kind of imaging we may need. So we may be sending them out for like an MRI or something like that after that initial consultation. But if they are ready to move forward with treatment, um, we'll send them with the red light panel immediately.
And then are you doing, you said that you have, I'm a radiologist and I'm kind of, I'm biased with the imaging, and you've seen some of
Yeah,
my talks and lectures on the follow-ups. Are you getting follow-up imaging after the therapies to see, because I've seen some cone, I haven't seen MRIs, but I've seen from the study group, the study club with the cone beam CTs, and just incredible
yeah.
change.
So this is all new enough that I haven't had any follow-up imaging yet, but we will. We're wanting to get it about 12 weeks after we complete treatment, and our standard protocol right now is about 3 sessions of PRF, about a month apart, with daily photobiomodulation at home.
Then are you seeing, like, this has been implemented for a few months now? Uh, have you had the discussions of leveraging the technology, for other applications and long-term kind of health and wellness discussions? And I know dentistry is really moving in that direction. There's a lot of, like, especially when you get into the regenerative and sleep and kind of the holistic aspects. This is a tool that doesn't get put back in the closet after you finish your TMJ treatment. Um, are those conversations that you're having, or how does that go? If I'm a patient, how do you explain that to them?
Yeah, so usually when I'm first talking about it, it's not uncommon for it to be the first time that a patient has heard about this. And so for the patient that's in pain, my initial conversation is usually focused on how this is going to help you with the problem that you're having right now. Um, and that was actually something that I kind of had to navigate my way through, because as I was reviewing the literature on photobiomodulation, it helps with so many things. It would almost, if you're not mindful about how you're presenting it, I think might sound like you're trying to market some kind of panacea, to a patient. So I'll focus on that first. As they're going along and coming toward the end of their therapy, that's when I start to bring up the overall wellness aspect of it. And I might even recommend that they change their daily dose as they're feeling better. Usually we're recommending 10 minutes twice a day for them when they're in pain. And then I tell them, you might be fine going down to 7 minutes or 5 minutes, twice a day once things are feeling better, but we recommend that you still use it. And we've even had patients that notice on their own. I've had some older ladies that come back and they're like, my wrinkles are going away,
That's cool. Yeah, have you
Yeah, I
had
had a guy that was like, I have to shave my beard twice as much as I normally did. Like, what's going on? Yeah.
Luke, you do implants, right? as well?
We do some, yeah. I don't do as many myself anymore. But my partners do, simply because I'm just spending a lot of my time on the dental sleep medicine and TMD stuff. But we are, yeah, we're looking at how to implement this on the general dentistry side for patients that are having extractions and need recovery, or having implants placed.
Yeah, that's what I was going to ask you about, because that seems to be an emerging area and an opportunity for pain recovery.
Yeah, one of my partners does a lot of surgery, and I've been talking with him. He's very, very interested. So I think here, probably over the course of this month, we'll probably have a chance to sit down, and I'm going to walk him through what we're doing and how it might apply to what he's doing.
Are there
That's excellent.
any cases that really stand out to you, both in and outside of your practice? I know that uh,
Yeah,
you sent us the write up that was beautiful, and you're really amazing, like almost miraculous in some ways. But would love for you to talk about, even in the clinical practice of dentistry with what you're doing, or even at home, as we talked about. You talked about this panacea. You- I went to the World Academy of Light Therapy, and one of the sessions with the thought leaders from all over the world was how do we uh, how do we stop from being labeled as snake oil, because literally
yeah,
it can treat so many things. And I really like your approach. It's like, hey, we're going to focus on this, but as you are healing and you're believing in both because the same thing can be said for PRF or regenerative medicine, because it's still, in some circles, it's not considered legitimate. And you're seeing, and I'm not in that, I'm a evangelist for regenerative medicine. And, but I love your approach, how you get that buy-in, you have the real results, and then you talk about, the other options. But speak to the other cases, if you would.
yeah. I was actually just reading an essay last night by Wendell Berry. It was called "Choosing Health," and it was really making me think about all of this. He was talking about how the medical industry has been affected by the Industrial Revolution, and how it was different before that. And he talked about how you have, and when you talk about health and wellness for people, you kind of have two different worlds that we live in. One is like your close circle, your family and your friends and the people that care about you, and like, you know, people that you're like, hey, you're having this problem. Well, I'm taking this supplement. Maybe you should try it too. The people that you talk to. And then you have almost this mechanistic approach to medicine that you see more in like a hospital, where you go in and things are kind of built around efficiency in that. And he told the story of a woman whose husband had had a heart attack, and he was in the hospital, and he was in the ICU recovering, and his wife was there with him, and she was really kind of grieving and concerned for him. And the nurses came in and saw this, and they were trying to comfort her, and they were saying, really, what he's going through is, there's a lot of people that go through it. He's not alone. There's, everybody goes through something like this that has a heart attack. And the wife of the patient looked at him and said, I'm not married to everybody. And then the conversation changed, and one of the nurses said, do you need a hug? And the wife said, I would love a hug. And she gave him a hug. But in my mind, it was just a really beautiful way to kind of bring together those two worlds of like the people that you care about and that you would do anything for. And then this kind of like, kind of mechanistic, scientific approach to medicine that we have. So these stories that I'm about to share kind of come not so much from me as the practitioner, but me as the family member, the concerned family member. So first story in May, this was right around the same time that I was just beginning to implement photobiomodulation in my clinic. One of my younger sisters, um, super healthy gal, never spent a day in the hospital in her life, was calling the family. She had recently been married and moved out to Utah with her husband, and she was telling us over the course of about a 2-week period, "Hey, I'm not feeling very good. I can't feel my fingers. I can't feel my toes." what do you guys think? Should I be getting this checked out? And she ended up collapsing, wasn't able to walk, and her husband took her to the ER. And fast forward to the next day, she was diagnosed with Guillain-Barré syndrome, which is an autoimmune condition where your immune system is essentially attacking the myelin sheathing of your nerves. And so she was having this really severe peripheral neuropathy, a lot of pain in her limbs and down in her sacral area, so much so that she couldn't sleep. Her ability to speak was being compromised. Her ability to swallow was being compromised, and to the point to where her providers were considering putting her on a vent. And it didn't seem like anything could really touch her pain. They tried a lot of different pharmaceutical interventions, and finally found that tramadol and Lyrica could give her some relief, take her pain from maybe a 10 to a 7 or an 8. And she got stable enough through that to be able to fly out to Ohio to be closer to extended family, because her and her husband are young newlyweds and they were in need of some support. We got a big family network out here. So they came out, and I had already been thinking, as I was kind of hearing the updates on how she was doing and getting more familiar with photobiomodulation, I thought this might be worth trying for her. It certainly couldn't hurt anything. So they arrived in Ohio toward the end of June, and on July 2nd, I went over to where they were staying, and I brought a Red Vive panel with me for her. And it really is etched into my mind, because when I walked into the house, she was laying on the couch. She couldn't sit up. Her husband was kind of sitting there holding her, but she could barely lift her arms, couldn't lift her legs at all. When she was speaking, her voice had really been affected by the condition, so she didn't sound like herself. It's actually really common, I guess, for people to adopt kind of a Southern accent when they have GBS, because it's easier to kind of speak with your words slurred. So anyways, that was the condition that she was in at that point. And to get around, her husband was either carrying her or she was in a wheelchair. But even in the wheelchair, it was hard for her to sit for long periods of time, because she just didn't have the strength to stay upright. And so she would kind of start falling forward. So they started red light that day, 10 minutes in the morning, 10 minutes in the evening. And 2 days later, we were getting ready for our family 4th of July get together. And our family group chat lights up with this video from my sister. And she says, "Hey, look at what's happening." And it was her up on a walker, and she had a gait belt around her, and her husband was holding her, but she was taking steps and going across the living room. And I thought, that's crazy. That was not the condition that she was in 2 days ago when I gave this to her. Well, she was in good enough condition that she came to the family 4th of July get together for a little bit. And I was talking to her, and I said, "Rachel, so tell me what your experience has been so far." And she said, "Oh my goodness, when I lay under the red light, my pain goes down to it doesn't even feel like pain anymore. It just feels like pressure in my limbs," which is just such a relief from the pain that I've been enduring. And she said, throughout this whole process, I have really been unable to sleep for more than an hour or two, because the pain wakes me up. And so she just hadn't had a good night's sleep for, I think over 6 weeks at that point. She said, "Since I've started this, I've been sleeping, I slept 3 to 4 hours, and now I'm sleeping, I made it to 5 hours last night. And the amount that I'm sleeping seems to translate into the next day. All of a sudden, I can lift my leg, I can lift my foot up." And since that point, she has really just had, function after function restored to her. Her voice became normal. She sounds like herself again. Earlier this week, she came over to visit me, and she walked from the front door to the end of our entryway, and I was standing there to catch her without any support. She's primarily just using a walker, and her husband uses the gait belt to help her around. she was in our kitchen, and we were kind of teasing her. We said, "You look like you're horizontal rock climbing," because she was kind of going around the counters. As long as she had something to put her hand on, she could get around. But as I've learned more about Guillain-Barré syndrome from her, and hearing what the neurologist that she's seeing has to say, and the support groups that she's part of, this seems to be a very unusually quick recovery for somebody. And the thing that she reports is decreased pain and increased sleep, and that seems to be maybe the bedrock that is underlying all of this. But phenomenal results. Nothing short of watching a miracle, really. Yeah.
And that's just this July, right? So just like a month and a week,
Yeah.
like 5 weeks that it
From
started.
what I
Wow.
understand too, it's not uncommon for patients with GBS to spend 6 to 12 months in a wheelchair.
Mhm. Yeah.
And I'm sure
Well,
there's yeah.
the timing is maybe a coincidence, maybe not, but it's to hear how dramatically that she improved. And what's really interesting is when we've talked about that before, kind of the neural inflammation and her the immediacy of that pain relief, that kind of analgesic, anti-inflammatory effect. That that's what we talk about. That you have that kind of continuous exposure, that you reduce that neural inflammation, you change the biochemistry of the tissues, and then it allows for healing. Right? And then you have
Yeah.
reduced pain. Your parasympathetics now kick in. She's able to sleep. All of this is kind of additive for that healing milieu. But what an amazing personal account.
Yeah. The
So
other ones that I've had recently since then, I've become kind of like the Oprah of red light panels in my family. But my grandmother was about a month ago now, was talking to me. I was visiting her. I could tell she was upset, and she was telling me that she had been to see her eye doctor because she's been having a lot of double vision when she was driving. And she said at church she would see two people at the pulpit, kind of out at that distance. And her eye doctor diagnosed her with Fuchs dystrophy, which is a degenerative condition of the cornea, and also told her that she was too old for any kind of cornea transplant surgery or anything of that nature. And basically just told her, you're just going to slowly go blind. And that's just how it's going to be. And from the webinar, I remembered you mentioning some of the intraocular benefits of red light. I use open evidence a lot when I'm kind of digging into different topics. I hopped on open evidence. I said, Grandma, hang on, let's look at something together. So I pulled up open evidence, typed in a question about Fuchs dystrophy specifically and photobiomodulation, and several studies came up that showed that photobiomodulation had reversed damage to the cornea caused by Fuchs dystrophy. And I said, I've got access to these kind of panels. Let me bring one to you. So I brought her one, and she started using it. And 2 weeks later, I was visiting her, and she said, I haven't had double vision when I've been driving for days, and it's been over a year that I've had that every time I'm driving. She says it's gone. So she's she's a believer. And then one of my other sisters recently gave birth to her first child, which was delivered via C-section. So we got her a red light panel right after as soon as she got home from the hospital. And she's been using that. And she called me yesterday, and she said, I just went in for my first follow-up, and they asked me, are you doing something special to help this incision heal? Because we don't typically see healing like this quickly.
wow, and you get the whole family believing and experiencing this. That's pretty cool.
Yeah,
Um,
yeah.
if you were to, as you look at your practice, if there are because you're fairly new into the regenerative medicine practice. If there are other dentists out there, other practitioners that are looking at this, do you have any words of advice, or any if they're a bit hesitant to jump into uh, photobiomodulation, any thoughts or ideas about it incorporated to allow them to feel comfortable? I mean, it sounds like, with your with the experience that you've had, obviously they're pretty profound, but even clinically that you're seeing on a day-to-day basis, are you like, I'm assuming that you're seeing some pretty good outcomes on TMD and sleep
Yeah,
as well.
absolutely. I guess the first thing that I would recommend is just take some time to familiarize yourself with some of the literature that's out there on photobiomodulation. This isn't, something that's unproven, and while it may be new, relative to other areas of medicine, the benefits are pretty well documented in a lot of studies. And then I would say from there, narrow it down to where you think you want to apply it in your practice, whether it's, healing after a surgical procedure or an implant placement, or in my case, if you're doing TMD treatment like me, and try to find how you can speak to a patient about that, and connect the patient's problem to how photobiomodulation can help provide a solution for them, which can take some time, and if you're anything like me, I feel like I learn best by doing it. And so I have conversations with people, I talk to people, I kind of make note of like, hey, that was effective, or, I might say that different next time, or I want to have this piece of literature printed off and on hand in the office for somebody that asks for it. And that's going to depend on what your application for it is, but find those resources, make them available, and then find how to communicate them in your own words to your patients. I would say, in the case of what I'm doing, we've definitely had a lot of success as just presenting it as part of the treatment, and explaining to the patient why. Like, when I'm talking to a patient about TMD, I'm covering, our approach, and, we're non-surgical, we're regenerative, and the reasons behind that. And as part of that regenerative approach, we're relying on PRF, and a photobiomodulation goes with that. And the reason that we're going to do both is because that's going to give you the best outcome possible. And that's what you're here for, is that outcome. And so really, showing the patient that it's not, not a deviation from, or an add-on to what they are looking for, but directly involved in what they're looking for.
Yeah. Yeah. I mean, that's when once you use it, you become a believer. A lot of the influence in my career, my utilization of it was, personal. And then it started to, bleed over to, no pun intended, bleed over to the, regenerative PRP side and stem cells. And it soon became incorporation. Like, it was just part of we believed in it so strongly that this is going to affect, a long-term positive change. Uh, it was just,
Yeah.
it was kind of lunacy not to include it. But I agree with you, is that it's really part of, like, you have to believe it, leverage, use it, experience it either yourself or through experience with your patients. And then once that, occurs over and over, it kind of becomes a no-brainer as far as how easy it is and how safe it is.
Yeah. I didn't even mention, but yeah, I do use it myself and tried it myself, and have seen benefits. I've tracked my sleep for years, using a Whoop, and see that I have increased time in stage N3 deep sleep when I'm doing the red light. I also, early on when I started using the red light, I did something stupid. I like woodworking. I was out woodworking, and I do green woodworking, so I was splitting a log in half, and ended up smashing my hand against the side of this log, and I had this big old bruise kind of running down the side of this hand. And I had just gotten my own personal red light, and so I kind of tracked my recovery with that, and I was like, yeah, normally that would be 2 weeks until that was, feeling better, but it was just a matter of days until I was feeling better, and then even quicker until the bruise was gone, which is great when you're a dentist and you work with your hands. But sometimes when a patient asks me, have you used it? That's something that I can bring up and say, yeah, actually I have, and just like your joint is inflamed and angry up here, I had some joints right in here that were pretty inflamed and angry not that long ago. And red light helped me with that. So, yeah.
Which one do you
Yeah,
use personally?
I have the 300, the Red Vive 300, and I mounted it to the wall in my bedroom. So first thing in the morning and before I go to bed, I stand in front of it.
Luke, I want to, I'm not a sleep specialist, and especially with the oral appliances, but we've been seeing a lot of the docs use it. One of the ways that they're using it is obviously for improvement in kind of sleep architecture and
Yeah.
getting that more of the entering the deep sleep. And what we've seen in looking at kind of the brain waste removal system, like getting rid of neurotoxins. I mean, we build up formaldehyde, the beta amyloid proteins, and those are going to leave our they build up in the CSF over the course of the day, right? The brain is so highly metabolic, you create all these metabolic waste products and you get rid of them. And when that happens at night, and specifically that happens when in deep sleep. So not REM or not in a second, that deep sleep phase where the blood-brain barrier opens up, and those neurotoxins, they're larger proteins, they're able to get placed back into the central vascular system and then removed to the leptomeningeal system. And so that's something that I'm in. It might also just thinking about your sister's progress and
Yeah.
getting more of that deep sleep, reducing systemic neural inflammation, central nervous system inflammation, and detoxifying. That plays a huge role. And then one other application, and that's why I'm not familiar with exactly how it could be used or if it's even relevant. When you do a sleep like the oral appliance, I was reading about it that there can be a lot of discomfort or pain, muscularly or soft tissue. Is that something that happens? Is that an application where they can use it more like regionally or topically for inflammation, pain control, muscle relaxation?
Yeah, absolutely they could. I think some of that depends on the skill level of the provider and knowing how to, a lot of the appliances are adjustable, and you certainly don't want to go too quickly, too soon for people. But yeah,
Oh,
people
so it's
can
like
get sore.
a progressive
Yeah.
change.
Or if they have, a history of a temporomandibular, dysfunction, which is not uncommon if they've been having years of bruxism in their sleep. Your average human, I think, can generate something like 250 pounds of force when they are clenching their teeth together. And our jaw joint and our teeth really should only be in contact with each other 1% of the time or less when you look at the studies that have been done on that. And when you're spending more time with your teeth in contact, generally bad things happen. And that's, a lot of the patients that have obstructive sleep apnea have some level of that going on. I see it all the time. In my general practice, a lot of times I'm looking in somebody's mouth and nobody's ever talked to them about obstructive sleep apnea, but I can see from the wear pattern on their teeth that needs to be evaluated. But anyways, yeah, in regard to the dental sleep medicine side of the practice, something that I will be looking into moving forward is how to incorporate it for those patients that maybe don't even have like a temporomandibular pain problem. They may be, there's a lot of reasons that people aren't sleeping well, and a lot of those reasons come down to things like pain, and so people come to see me on the sleep side because we can get them breathing better while they're asleep, but that may not be the only thing that's affecting their sleep. And I think photobiomodulation could definitely have a place when those patients are maybe facing other factors that are compromising their sleep architecture. It's interesting to see there is a definite association between sleep and pain, where if you're having fragmented sleep, you're not getting through every stage of sleep and getting that deep sleep like you should be. They've documented it's called central sensitization, where essentially your body's internal pain management abilities are compromised. And then probably a lot of it, on a physiologic level, has to do with some of that lymphatic clearance, removal of waste from the brain. I think for patients that are coming to me and maybe looking for something more than just, hey, I snore and I would like to stop, red light's going to be part of that conversation.
Yeah, it's really fascinating, and it's now with these wearables and trackables, it's pretty obvious. Like I see that same thing with using photobiomodulation, like the Oura Ring. You can measure it's fairly accurate your deep sleep, heart rate variability. I've seen dramatic improvements in that, and we've worked with some kind of world-class athletes, and they've been tracking for years, and then they implemented red light in the past year, and so we have this longitudinal data. I should show you this data set that somebody sent me. It's pretty incredible. Like it's just
That's
their
cool.
sleep time is just dramatic. The deep sleep, REM, and then their HRV went from 60s, 70s to mid hundreds. I mean, a huge jump in that in heart rate variability, which is one of the measures of kind of overall health and parasympathetic tone and the body's ability to adapt, and its resilience. And so it's pretty amazing stuff. Yeah, so
I'd
I'm
love to see
excited to see
that.
how you. I'll send it to you. It's just really cool.
Yeah.
I'm really excited to see how you're implementing it, because obviously what you're doing already is pretty astounding, just within a few months of implementing this and seeing the changes that you're seeing. So kudos to you.
Well, thank you. Yeah, thank you for presenting it to the Spencer Study Club. That was a great place to be introduced to it. And yeah, I think I would imagine that anybody that starts implementing it on any level, you'll find yourself in the position that I'm in right now, which is you're not looking for ways to like use it less in your practice. You're just like, you start to see the other applications for it, and you're like, okay, how can I apply it there as well?
Yeah, you know what? That's interesting you say that, because on that note, Rahul, you just told me the other day about studies that had to do with photobiomodulation and Invisalign. And do you have any insight on that?
Well, I've just been, I don't know if it's specifically Invisalign, but for I guess mobility, there were some studies
Okay.
that, and I didn't go super deep into it. I actually just started one of the, it's a competitor of, so if I'm lisping a little bit, that's why. I have my, these appliances in right now, but the use of photobiomodulation uh, allowed for more rapid adjustment of teeth alignment. So the teeth movement was a little bit better, a little bit faster with
That's
red light
fascinating.
application.
Yeah.
Yeah. And so I don't know if that was, I didn't look in, say I didn't look super deeply into it as far as if it's intraoral or extraoral,
Okay.
how where the light device was placed. But obviously we are seeing for cases of even intraoral pathology, say oral mucositis, that there is a effect with even extraoral, through the buccal mucosa, like the skin and the soft tissues, that there will be enough energy penetration into the oral cavity to affect a change. But I don't know if that's the same for gums. And then we're looking at what kind of one of the other questions I had to you, and as we start to see these different use cases, some things that have come up, internally with us is like general dentistry. Like, what are the applications for extractions? What are the applications for infections? And then there's been a lot of interest from the dental implant community, both kind of the
Yeah.
traditional and even the ceramics, and then those that are using kind of additionally orthobiologics for grafting. It seems like there's a absolute use case and a potential indication for like photobiomodulation along with that.
I'm seeing it more mentioned with some of the lasers that are marketed to dentists, that they're starting to include these photobiomodulation settings, and recommendations on how to use it. Something that I've been thinking about is I've been thinking about the applications in general dentistry, are my sister, for example, went to an acupuncturist as part of trying to get some relief from her symptoms from GBS, and they used like a cold laser, which she said had a similar effect to using a red light panel. But she said to me, I don't think that I would have noticed the relief as much without the daily application of it. She said, I think it would have been too infrequent with my visits to the acupuncturist for it to really have the same level of effect for me.
Yeah.
And what I love about the panel-based solutions and LEDs is you can send those home with a patient. But the instant, it's a laser, a lot of times the only person that can administer that is, a dentist or a physician. And that's probably not because of the photobiomodulation features. It's probably because of everything else that the laser does that's the case. But I like kind of democratizing it in terms of, getting it into the patient's homes and having that daily benefit from it, because it does compound over time for sure.
Absolutely. Yeah. A lot of times, especially depending on your setting and your wavelengths, the low level laser therapy, even though if it's a class, 3 or 4, it's collimated, it's a focused beam, there is potential for thermal like burn injury. And so that's why it's in this different class, right? It's a class of 3 or 4, which means it has to be in the office setting. The medicine that it's, when we talk about photobiomodulation, the medicine that it's delivering is the same medicine. If it's that same way, like the 600 to 900 nanometer wavelengths, it's the same medicine. It's just a different delivery mechanism. So, in a very layman's terms, if the sponge is the tissue, if you're using a laser, you're taking like a syringe, a needle, and injecting it into the sponge. With photobiomodulation from an LED, it's like taking the sponge and dipping it in a bowl of the medicine, like in the water. So it's like saturating the tissue, and you don't have that thermal effect, that concern. It's a polychromatic and it's a diffuse zone, so it's much safer that way. So that's why it's been allowed to go home. And I that's why I'm so passionate about what we're doing, is that I like the word democratization. It's like extending the walls of your practice so that you're able to affect that change. And I think it is that microdosing effect that every day. And I even feel like, as we talked about the evolutionary biology of AM and PM, like when do you get natural red and near infrared light is in dawn and dusk. And I also think that there's something to, if you have to use it at home, use it in the morning and use it in the evening, like as nature kind of intended. I think that makes also a lot of just, common sense. To like when your body, they've shown that the mitochondria in your cells actually respond to the same medicine. It responds differently. If you have a normal sleep pattern, you respond differently in the morning than you do in the evening. It's more stimulatory in ATP production and mitochondrial activation in the AM versus some of the more parasympathetic kind of growth hormone release, melatonin release, like getting into that. We talked about the sleep benefits, reparative stem cell activation in the evening. So it's really interesting. Our body's such an intelligent system.
Something that just occurred to me as you were talking about that is, in the case of somebody that's transitioning even to like dentures, not even implants, it's a common situation in dentistry where people don't want to go without teeth, but they have a lot of healing to do once the teeth are extracted. And that can be a really challenging situation for both the dentist and the patient, where the patients maybe got these dentures that were made to be placed immediately after their procedure, but the whole shape of their tissue, their bone and their soft tissue is changing as they're healing. And that can go on for quite some time before it settles down. And then often the denture is then modified to fit, or a new denture is made to fit their mouth at that point. But it would be interesting to see if daily photobiomodulation can maybe get somebody through that healing a little quicker, or with less inflammation, less discomfort, as they're adapting to wearing their denture.
Interesting. How long is that phase usually?
It can be very individual. Honestly, I've seen bony changes that can happen out into 2 and 3 years post extraction. A lot of the soft tissue, provided that someone's healthy, may be resolved in 8 to 10 weeks.
There's a significant period there with pain.
Significant period of time, yeah. And then, if somebody has some other underlying, systemic health problems, that healing can really be delayed depending on their exact situation. But that, that's often kind of as the dentist and the patient, you're kind of fighting your way through that healing thicket to get to a point to where they can have a prosthetic that they wear that's comfortable and fits. Be interesting. I'll have to work on that in the general side of our practice.
Yeah, let's do it. Well, on our next time we have you on, we get some feedback on that. Just being cognizant of time, I just want to again thank you so much for you spending time with us and discussing your stories and utilizing the photobiomodulation in your practice. And for those in and around the great state of Ohio and West Virginia, how did they get in touch with you, or what's the best way of finding more about your practice and how to come
Oh
see you?
yeah, if they're wanting to learn more about my sleep and TMD practice, they can go to bettersleepmov.com. It's Better Sleep Mid Ohio Valley. Or if they're looking for me on the general dentistry side, if they go to familytreedentist.com. Family Tree Dental is the name of the general dentistry group that I'm part of.
Okay,
Awesome.
excellent.
Well,
Jay, do you
thank
have
you
any
so
other
much.
final questions?
No, this has been great. Just it's been great listening to both of you talk about this. So thank you very much for this again, and we'll definitely have you back on.
Yeah, absolutely.